Good afternoon, and welcome to the third Regional Elected Leaders Initiative, otherwise known as the RELI webinar of 2026. My name is Karen Corbett Sanders. For some reason, my video is not working, but I will continue anyway. My name is Karen Corbett Sanders, and along with Mary Hines, I direct the RELI program at the George Mason Shar School of Policy and Government. And here is our dean, Mark Roselle.
Hello, I am Mark Roselle and I am the Dean of the Shar School of Policy and Government at George Mason University. I am pleased to welcome you to the Spring Regional Elected Leaders Initiative, better known as RELI, webinars. We are excited to have 4 members of Governor Spanberger's leadership team join us over the next 8 weeks as the Shar School celebrates its 10-year anniversary. And we are proud to continue RELI's 8-year dedication to enhancing regionalism and supporting all of Northern Virginia's elected leaders. There is no doubt we live in interesting times where serving an elective office is increasingly challenging. The Shar School and RELI aspire to connect, educate, and engage leaders in service of positive change for their communities and our region. I want to acknowledge RELI's key sponsors, AT&T and McGuire Woods, our many organizational partners, and the esteemed group of former elected officials that make up our advisory board. I hope you enjoy the webinar. Thank you.
RELI's goal is to enhance regionalism and support Northern Virginia's regional elected leaders. General Assembly members, city and town mayors, and council members, county supervisors, and school board members. Through programs, podcasts, and events, RELI strives to help our region leaders engage, learn, and connect, all in service of creating positive change for Northern Virginia. This webinar is sponsored by AT&T and McGuire Woods Consulting. We're grateful for their support, and we hope that you will join us over the next few weeks for our leadership chat with Secretary David Bulova on June 12th. If you have not seen our webinars with Secretary of Transportation Nick Donahue and Finance Secretary Mark Sickles, I recommend you take a look. Governor Spanberger's first cabinet appointment was Marvin Figueroa, most recently of Arlington, Virginia. He has been appointed as the Secretary of Health and Human Services. Secretary Figueroa shares Governor Spanberger's commitment to practical results-driven solutions that matter at the kitchen table. His tenure builds on his tenure as the Deputy Secretary under Governor Northam, and in that role, he collaborated with agency leaders, health systems, and community partners to expand Medicaid, broaden behavioral health supports, strengthen social services, and improve public health operations. Secretary Figueroa has an impressive background in the private and public sectors, in the federal government and working on Capitol Hill for Senator Warner, focusing on access to affordable care, strengthening programs that support families, and improving how government meets the needs of its communities. His career has been guided by a core belief that policy should widen opportunities and give everybody a fair shot. Originally from La Ceiba, Honduras, Secretary Figueroa was a Posse Foundation scholar and has earned degrees from Vanderbilt University and Harvard, as well as a graduate of the University of Virginia's Sorensen Political Leaders Program and Lead Virginia. I'm also pleased to welcome Matt Lehrman back to RELI's webinars as today's moderator. Matt is a co-founder of Social Prosperity Partners and facilitates strategic planning, civic engagement, and community dialogues nationally. We've collaborated with him for several years on his Community Catalyst podcast series, annually highlighting 9 Nova leaders and their hard-earned lessons, insights, and inspirations. Matt, it's all yours.
Karen, thank you very much. And if you figure out how to fix your camera, you should just pop in and just wave to everyone so everyone can see you. But thank you very much. And thank you again to Relly. Mr. Secretary, good morning or good afternoon to you, and nice to meet you. Thank you for being open to this conversation. And to everyone joining us, welcome. We're grateful that you've taken the time to be part of this dialogue. I'm going to encourage you to use the Q&A function to share your questions for Secretary Figueroa. I'll be keeping an eye on those throughout the conversation, and I will bring them into the discussion as we go. Mr. Secretary, before we kind of get into a big, broad conversation, can we just start where things are with the budget right now? I just don't want to lose the lead here, and make sure that we're talking about things that are current that may have even changed from a couple of weeks ago when we interviewed the last secretary. What can you tell us about the current status of the budget process?
And thank you. It's so good to see you, Matt, and I'm glad to be a part of these conversations. I think they're very important as we try to communicate from here to Richmond, but also ensure that we're hearing from other people as well and having that bi-directional dialogue. In terms of the budget, you saw that we have an announcement that we have a date where we're going to come back and have a broader conversation publicly about what we need to, how can we advance to ensure that we meet our internal deadline, but also the deadline that has been fixed for as long as we can remember. Look, I think what you're seeing right now is policymaking. Even if you have all Democrats in control of each branch, it still means that we have to have a discussion and try to align priorities. Overall, though, that we are focused on making sure that life is more affordable for Virginians. We have different perspective of how that looks, but I think you will see us align overall in the next coming weeks.
Thank you. I'm just going to do a quick call out to Karen, who I see her camera is working. So just Karen, just wave and just acknowledge. And Mr. Secretary, if you want to say hi to her, that's fine. It's not a full day, Karen, if we don't see your face. Thank you. Mr. Secretary, as we've been having these conversations, there may be people who are not paying attention to all the details. So I just want to make sure that we're all caught up. If I understand correctly, the three big issues that there were questions about whether there was going to be a signing, a veto, or just an expiration and letting something kind of pocket veto out of it was retail sale of cannabis, skill games. If I understand correctly, those two are officially vetoed, right? The kind of the big lingering policy question is about the data center tax policy. Do I have that right?
You do. I mean, there's the majority we agree on. I think, of course, there's always going to be that 10% where we have to have a broader conversation about. You are right about the vetoes that have happened. The governor had sent down her amendments down to the General Assembly. The General Assembly did not accept those amendments, and so she decided to veto those bills with an understanding that we will come back and have a broader conversation given and during between this session and the next one. The issue of data centers is something that you all have covered and is a live discussion. The governor believes that we need to keep our commitments, but at the same time believes that data centers should pay their fair share. And so that'll be the discussion that we continue to have with the leaders of both chambers. And so hopefully we will be reaching an agreement fairly soon.
You want to set any expectations or share anything today that, just between all of us on the webinar here that might give us some confidence or encouragement of how it's going?
I think all the leaders involved in this discussion are committed to arriving at a resolution, one that works for Virginia. So I think you should expect us to reach that resolution fairly soon.
Thanks. I have one other kind of introductory question. I was listening. Oftentimes, I imagine this happens to you a lot. People introduce you and they get the title just slightly wrong, right? It's easy to say Secretary of Health and Human Services, but you're actually Secretary of Health and Human Resources. And I wonder if I could ask you just to explain how human resources in Virginia is something different or greater than human services.
There's always a Virginia way. um, and some of that way you really can't explain. When I look at my colleagues across the country, their secretariats are just structured differently. Some have oversight of both the healthcare component of it and the social services component. Others do not. Here in Virginia, we're 12 agencies that report up to the Secretariat. But I can't tell you why resources over services. I just know that this is the biggest secretariat that we have in the Commonwealth. And we have such a range of services from birth, right, and all the births that Medicaid covers to end of life, when we are talking about some of the services there, and that we have aging and DARS. So we have a range of agencies that deal with a range of things. But why resources and not services? I would chuck it up to the Virginia way.
The Virginia way. So, Mr. Secretary, to prepare for this conversation, Relly brought together local leaders from across Northern Virginia in two focus groups that I had the opportunity to facilitate. And those included leaders who were elected officials and school system leaders and housing and human service professionals and healthcare and behavioral health advocates and regional planners and a lot of other people responsible for local services and community well-being. And my role here in asking you questions is to bring their perspectives into this conversation. What we heard repeatedly was this, that local leaders in Northern Virginia feel like many of the systems that people depend on most, that's healthcare and behavioral health and housing supports and food assistance and public health and family services, that everything seems to be under pressure all at the same time. And not necessarily collapsing, but strained and uncertain and really hard to predict. And there was one leader who said, we're trying to stabilize people's lives while the systems themselves feel unstable. So I was hoping we could start there. As you've stepped into the role, and I know it's only been a few months, what do you see as the current condition of Virginia's healthcare systems, and what kind of concerns you at this moment?
Okay, just jumping off from what you mentioned, those leaders are telling you. I agree. What I'm seeing too is a system that is having a number of different policies shock the system. So let me give you an example. Like when I think about the big beautiful bill that passed last July, that is a shock to the system. And so right now we are trying to minimize that shock. But it is undeniable that a bill of that magnitude is going to have an impact on our ability to render the services that Virginians need and deserve. So the billions of dollars being removed out of Medicaid, that is going to have an impact that the federal government is taking away from the system. The SNAP error rate and the financial impact that it can have on our budget, that is going to have an impact. The new requirements of both Medicaid and SNAP are going to impact our ability, again, to be able to provide healthcare services through Medicaid, but also ensuring that the people who need food assistance programs actually receive it. That is going to have a shock on the system. And when you move back a little bit, we are in a situation right now where the system is not as predictable, even in a world of instability. This is the most unstable it can be. All right. Every day we get a surprise in a world in which these systems are not flexible enough to move to address those surprises. And so your leaders are not saying anything that we're not feeling here. And what our challenge is ensuring some level of instability in a world that's becoming increasingly unstable.
So, what do you think is the responsibility of the state to create that stability when the federal government, as you just said, the big beautiful bill, is responsible for so much of it, but the brunt of it is being felt at the local level? What could or what should the role of the state be in that moment?
Thoughtful implementation, and bring in leaders from across the government together to make sure that we're being thoughtful in our implementation. Right. So what we have done, we set a governance structure together for Medicaid and both for SNAP, but overall for the big beautiful bill. We're going through line by line, ensuring that we are compliant with what the law requires, while at the same time ensuring that our Virginia values are being infused in how these things show up in people's lives. how are we doing this that can improve, or we're doing it in such a way that doesn't surprise people on the ground, is making sure that we're communicating consistently, right? Communicating with our locals, communicating with leaders across civic life to ensure that as we're implementing, they are getting an opportunity to have their input being reflected in that implementation. And the conversations like this, I would say, right? Like we are making ourselves available as a secretariat, as a mandate from the governor to make sure that we're accessible, because you need to have the opportunity to be able to ask questions and have that dialogue to make sure that you're also communicating to the people you represent.
You know, I want to be really careful. I don't ask gotcha kind of questions, but I do need to press a little bit on something because the budget situation is, produces its own uncertainty for local municipalities. And on top of that, then there are this question of the consequences of knowing which programs they're going to continue and how they're going to continue. And what I heard in the focus groups with local leaders was a kind of a grounding in the idea that even before the decisions are made, there are consequences where people are delaying decisions, they're holding back on making investments, they're preparing for disruption. And I wonder if I could just ask you to speak to your understanding of how this uncertainty is all playing out from the level of residents and citizens of Virginia who are on the kind of they're the tail on the dog here, who have to make decisions for themselves, but are operating not just out of uncertainty, but out of concern and even fear.
We're doing our best to arrive at a resolution for the budget, and we will. Um, and then we're working with our state and local partners for the uncertainty that we're getting from the federal government in a consistent basis to ensure that people have what they need to be able to make those decisions. What I think I'm hoping people understand is, for as uncertain as those individuals are on the ground, we're getting the same amount of uncertainty for the federal government, trying our best to be able to interpret in such a way that creates some level of here's what's to come for those localities that have to make their own funding and financial decisions.
So we're all in this together.
We're all in this together. But this is something that concerns the governor, right? And she is doing her best to make sure that we are creating, again, that predictability is super important in these situations, because we know that you can't plan if you don't have a sense of what you have and what you don't have.
Yeah. One of the things that really stood out in these conversations is that local leaders, they don't just experience health and human resources as, well, they're not abstract policy areas, and they're also not distinct, separate from everything else. So, if someone can't get behavioral health appointment, or if an elderly resident, can't remain, safely housed, or if a family can't access childcare, or if emergency rooms are overwhelmed, or, where someone in crisis could go other than to jail. And I wonder if, from your perspective, what do you want people to understand? Now we're talking about local leaders and how they govern and how they serve their local communities. What should everyone understand about how interconnected all of these systems are?
Matt, I think that is a great point. Um, I've been visiting a lot of the social services where they have co-located behavioral health, and they also have other services because on the ground, as you mentioned, those things are sometimes indistinguishable, right? So making sure that there is more of a one-stop shop. Um, that's not the way that we're organized here at the state level. And that is a challenge. And so one of the things that I've been pushing for is this idea of one HHR, which is that even if you have all these different agencies with different mandates, different missions, and different responsibilities, people don't experience us as different agencies.
Right.
And so, for example, I just came back from a discussion with some of my agencies that focus on crisis care to make sure that they understand what each other do. And many of them have some relationships and work on projects together. But I want them to work on projects more, right? To ensure that we're doing the work on the prevention side, but also ensuring that we're dealing with crisis and then dealing on the other side of crisis, which is preventing the future crisis. I brought them all together recently on food assistance programs, because I have 4 or 5 agencies that have food nutrition programs, and the same thing for employment support. So I am trying to mimic what's happening on the local level, which is ensuring that the agencies that are dealing with some of the same things are coordinated so that the local level doesn't experience the fragmentation that sometimes happens at the state level.
You raised a few issues, and I probably should kind of come back up to altitude and ask you in this moment, are there a certain few priority areas where you are especially putting time and attention and really trying to drive those forward?
Yeah, I mean, I can't underscore how much time I'm spending on the implementation of the Big Beautiful Bill, or HR1, because it has such a drastic impact in the way that we conduct the business of healthcare and ensuring that Virginians have what they need. And so that is consuming a lot of my time. Right now, we are waiting some guidance from the federal government on on the definition of individuals who are going to have to comply with the work requirements. We have one interpretation that is widely accepted. What we're hearing is that interpretation will not be taken by the federal government, and so it's going to require a different set of planning and, again, more instability into the system. So we're keeping track of that, but also being mindful that we have to do a good job in implementation. The other big one is, right, there's more people in Virginia that are hungry. And so looking at our internal programs and ensuring that we're working across the different sectors to make sure that those individuals have access to food. And so those are the big two right now. It is the implementation of the Big Beautiful Bill. It is essential services like food and ensuring that they're continuing and they're available. And then I'll say too, look, one thing that I kind of lumped into HR1 is that the amount of dollars that are removed from the system is going to have a drastic impact on rural health. And we do have a rural transformation fund. It's not a one-to-one dollar, but we have to figure out how do we use the money that we did get to ensure that we create some level of stability in rural communities.
I wonder if I could ask you to explain something too. I understand in Virginia that it's kind of a hybrid system for health and human resources. Do I have this right? 120 departments. I think that's the number you said a little earlier. And it's a connection of state and local agencies all trying to work together. And you mentioned one, HRR. Could I ask you just for a quick overview, what is the virtue and what are the vulnerabilities of that kind of a system?
Local gets to address locally the issues that each locality has, right? And
That's
so
a virtue, or that's a
I
virtue?
believe it's a virtue. Virtue taken too far sometimes becomes a vulnerability, right?
Yeah.
And so in this situation, local social services and the localities are able to customize based on their needs, right? So they understand their population better than you can in the state level by and large. At the same time, you have a lot of variability, which also creates risk. And so that is the risk component to that I will say. I think when you look at HR1, you're having to bring two big agencies together to collaborate on these big projects in a world in which they also have a lot of different responsibilities to begin with. And so the challenge is bringing them together for this legislation implementation in a way that gets us to implement it in a way that gets us to implement it in a way that helps people. That is a challenge. And within that challenge, a number of different risks. Whenever one part of the system is not talking to another, it creates an opportunity where we are not able to accomplish what we need to accomplish.
The vulnerability is not just the communication, but the cohesion between
The
all these different
cohesion,
things.
the cohesion. I mean, you can start. There's a lot of dependencies. So you can start a project here, and I got my part of the project done really well, but then it needs to go to someone else to be able to complete the project. That communication is essential, but also ensuring that the other side of the house has the implementation tools that they need to be able to implement it. And then you have the operating system that has to all come together.
Is the one HRR, is that your vision or this administration's vision, or has that been talked about for a long time? I'm really wondering is what is the long-term vision for the system?
Yeah, I mean, the I won't take credit for it. I would say that it's from conversations that I've had, and having also been part of the governor's transition team. One of the things that she's always talks about is this idea of durability, right? So making sure that we're building systems that work, and also building systems that last. And so when I look at the secretary that I'm responsible for, given the fact that we do have 12 agencies, is trying to take her vision of durability and sustainability, and it works for Virginia families, being able to apply it and ensuring that we're all one HHR moving in that direction.
if I could hit a fast forward button and look at what this would look like 4 years from now as we approach the end of the governor's administration, or maybe 3.5 years, what would be different, would you hope, in the near future from today?
That there's less friction between people and the services that they seek. That government will be not an impediment, will be helping them get where they want to go. And what does that mean, right? I see right now that people have to go to multiple. We know that some people qualify for multiple services, but we make them apply multiple times to be able to get it. So, is there a way for us to be able to simplify that? We will have implemented the big beautiful the bill in such a way where we have reduced churn so that people keep the coverage that they have and create some level of stability. And at the same time, those work requirements that we are compliant, but we're also helping people move up the economic ladder. Those are all things that are aspirational, but they're also doable if we have that perspective that we have to center the individual in everything that we do.
Excellent. I'm going to remind everyone who's joining us that you can use the Q&A function to submit questions for the secretary. I see there's one already waiting for me. And if you have questions, I'm happy to receive them. I will find the appropriate place to make sure that we ask all of your questions. Mr. Secretary, there's a question that I actually received before we started today, and I'm sorry, I don't know who it came from, but I thought it was an interesting question, and I was just reading it in the news this morning as well. I understand that Dulles Airport is designated as one of the primary entry points for people who have been traveling in Congo and Uganda and South Sudan, where the Ebola virus is going on. Obviously, there's a federal level to all this, but I am curious to ask you, what role does the state play in protecting Virginians and protecting everyone in the area?
Big role. I mean, we're working and coordinating with the federal government. It is a highly controlled process, but we are making sure that even as Dulles is an entry point, that we have everything in place to ensure the public health of every Virginian. But this is nothing new either. Dulles tends to be an entry point. And so this is not something that we're out of practice. We practice this consistently, and with the federal government in this situation, collaborating closely to ensure that we are following every single protocol to ensure public safety.
I don't mean to pry, but can I ask, is there anything more specific that you can tell us about the nature of that relationship, the role that the state actually plays in this?
It's a collaboration. So can't distinguish, can't give you a line by line in terms of here's the federal responsibility versus this is the state. But what I can say is that we do this across the board. Whenever there's there's an outbreak we do it with resettlement as well. And so that relationship between the federal government and Virginia is strong, and is one that we constantly make sure that we're working on, and everyone has their responsibility. And so there is something to be said about having it being longstanding and understanding each other's what strengths and weaknesses we bring, and making sure that we are strengthening each other in the process.
Okay. Let's see. I've got a couple of questions here. Chris Sigler writes, Secretary Figueroa, thank you for participating in this discussion. As you know, there is an alarming trend of rising numbers of early onset colorectal cancer cases. Are there any ongoing efforts to increase awareness of the importance of routine screening and/or efforts to increase funding to help our underserved populations to get access to these critical screenings?
Yeah, I mean, most recently during colorectal cancer month, we did a number of initiatives to raise awareness. Our Secretary of Public Safety is a survivor of colorectal cancer. And I think there'll be more work that we do moving forward on improving our screening rates through our Medicaid program and through VDH. And so there'll be more. We've already started, but there'll be more to come.
Thank you. And Anna Ricklin writes, how are you partnering with other state agencies like transportation or housing to improve the community factors that shape health?
In a meaningful way. I work with the Secretary of Commerce on housing. Our Department of Behavioral Health has a lot of supportive housing initiatives. We are right now monitoring a rule change at the federal level that could have an impact and will have an impact on our ability to be able to house individuals, especially those individual behavioral health needs. And so we're also looking across all these different secretariats to see where else we can collaborate. So yes, collaborating with the Secretary of Commerce on housing, but also on work supports and ensuring people are employed, working with the Secretary of Commerce again, but also education and labor to again make sure that we're bringing in all the different resources that we have to bear, because people again experience us not as secretariats, but as the things that they need in order to be able to have a good life.
Mr. Secretary, behavioral health was a topic that came up very frequently when I was facilitating this these focus groups for leaders in Northern Virginia. Leaders talked about rising anxiety and isolation. They talked about addiction and crisis response fatigue, and a lot of pressure being placed on schools and hospitals and law enforcement and local government to respond to needs that local government often feels under-equipped to manage. And at the same time, many acknowledge that Virginia has made substantial investments and improvements to behavioral health over the last few years. So can I ask you to reflect on where has the Commonwealth made meaningful progress, and where do you see the gaps that need to be addressed most urgently today?
Yeah, we've done incredible work on reducing overdose deaths. We made significant progress as well as at improving the continuum of care at the community level. So those are things that we need to celebrate. But I also see significant gaps. I have an incredible commissioner, Commissioner Washington, used to lead the Community Service Board in Fairfax. And he is looking at how do we strengthen those community-based supports. We have an issue with our state hospitals. The census at those hospitals is always full. We need to address that because that's a system failure. Something is happening along the way that results in individuals having to end up in our psychiatric facilities. We also need to figure out, yes, as we're moving towards more evidence-based services, how are we scaling them down in a responsible way, the ones that may not be as much, and how do we scale up the ones that are more evidence-based in a responsible way, in a way that doesn't create a crack where people fall through. We also have more work to do to make sure that there are available services. So what you're seeing is there are places where those services are available, even within urban centers, where they're available and robust, and you still have inequality in some places where those same services are not available to the people that need it the most.
I think I heard no, I didn't. I know I heard a comment from a lot of people who said that they feel like they're managing systems that were never designed for the level of need that they're now seeing. Do you think that's accurate?
I think they're managing a system that has increasing demand on it and that is not growing, and that supply is not growing as fast as that demand. And so that's what we're seeing. Is also true that when you have a situation where, again, I'll go back to the big, beautiful bill. A lot of if you look at even hospital economics, the service that goes away or is reduced is behavioral health because of how the numbers don't tend to work out for hospitals. And so we are going to see even more of that instability because of the dollars that are being removed from the system. And again, it is us working across different sectors to make sure that that reduction is not significant, and that we're ensuring that we have a basic level of those services for Virginians to be able to take advantage of.
So on the scale of investing more money to increase the capacity versus restructuring things, profoundly to better deal with it, what's the relative weight between those two priorities?
Is a good question that I don't have a good answer for. I think it is a constant friction point, and it is a constant rebalancing that we have to do when it comes to these things, because you also have to factor in what resources you do have available, and you don't have those same resources available across the board at any given time.
Could I ask you to talk a bit about just the burnout of the people who are working in those systems? It's staffing shortages, it's emotional exhaustion, it's this is not unique to Virginia, but it is, you know, it is common among caring professions. How do you understand that, and how do you think about the role of the individual caregivers in this moment when there is so much budgetary and structural and high level things that are out of people's control?
Yeah, I mean, who takes care of people who take care? That is a question that we're asking ourselves here. I think part of the answer, which is not a complete one, is one, how do we compensate them in a way that they deserve? How do we ensure that they're not taking on more, right? So how do we reduce those vacancy rates to ensure that less and less people are doing more and more? That is part of what we're focused on. And then how do we bring new people into that system as well, to guarantee some basic level of staffing across the board? Uh, None of those things are easy, right, Matt? I think you're seeing a trend here in my responses, but we are having those different conversations in different places, and also supporting localities in those decisions.
There's a question from James Dyke who writes, are you planning to address Virginia's efforts to comply with the permanent injunction related to better integrate people with severe disabilities into society?
That has been a priority of ours for years now. That is something that I talk to our Department of Behavioral Health almost weekly, and so we're working towards making sure that we are meeting our obligations.
Um, Mr. Secretary, you played a central role in one of the most consequential health policy changes Virginia's had in recent years, which was the implementation of Medicaid expansion under Governor Northam, which, as I understand it, ultimately extended healthcare coverage to more than, am I right, 500,000 Virginians?
That's right.
So, in many ways, local leaders told us that they see that decision as proof that government policy can genuinely change people's lives for the better. At the same time, we also heard concern that coverage alone doesn't always guarantee access, particularly when it comes to behavioral health care and specialty care. And I think you mentioned rural healthcare capacity. So when you look at the next phase of this work, what does success look like now?
Look, I would agree that coverage is the first step. Um, that you don't get to access without first having coverage. But I don't also believe that coverage is enough, and so it is creating that access, or improving that access that you just described. So that's part of the challenge ahead, especially in the financial situation that I think most states are going to find themselves. It will be a challenge, but one that we are going to tackle head on. I think affordability is a big one, right? So yes, we have Medicaid, but there's thousands, hundreds of thousands of Virginians that also depend on the marketplace. And how do we ensure affordability and access, not only coverage, but also access for those individuals who, because of federal changes, are either having been priced out of their coverage, or if they do have coverage, can't access it because of their copays being too high or their deductible being too high. That is another big issue that the governor is tackling through the budget. There's a direct subsidy proposal that we have in there, and so those are going to be two big things that we are going to have to confront and tackle head on during this administration. You already heard the work that we're doing on Medicaid. We're going to be doing some of that work on the private market, and we're going to be doing that across different areas as well.
What do you think that local leaders most need to understand about where Virginia's healthcare systems remain vulnerable despite the progress that's been made?
Look, I think they should know that we are available, I'll come back to your question. I think we have an understanding because we talk to locals in a consistent basis in a meaningful way. I see those things from the reports that I get, and when I'm out there also talking to people on a local level about what they're facing. What I think locals should understand is that the solutions are going to come out of these discussions happen because we both decide to commit to addressing them together. But it doesn't happen as fast as we want or as fast as we need, but it still means that we have to engage in this conversation and figure out what is the advancement that we can make. And that is a challenge, right? Because at the same time that we're saying, man, this is hard, it is people that are having a struggle with whatever that thing is. And so again, it is getting started and doing as much as we can as fast as we can.
I'd love for you to help me read between the lines on what you just said, because I'm trying to understand whether what you're saying is that we should think of this moment as kind of short-term turbulence that we're going through because there is an administration that is pushing this particular agenda, or is this the new normal? And we have to come up with solutions that, are going to adjust in this moment, but we have to get used to working in a reality that's not going to go back to the way it ever was.
Normally in a flight, turbulence tends to be part of the flight at some point, and then you go back to stability. I would say that right now the flight is turbulence. And so what can we do to create some stability within that turbulence is what we need to collaborate on, right? And so again, you just read the news. One time, at one moment we have the grant, the next minute that grant is being pulled,
Exactly.
right? And so that is turbulence, right? In a system that is not designed to address that turbulence quickly, we need to figure out together, can we do it as quickly as we can? And that is the challenge. But that's one that we have to, again, be consistent in our communication to make sure that we're creating some stability in that turbulence.
I don't want to get too caught up in the metaphor, but that's beyond turbulence. That's like choosing a different destination that we're going through. It and forgive me, I don't want to put words in your mouth, but it almost sounds like you have moments of frustration as much as the local leaders that I heard from in the focus groups about not knowing, what we can count on in this moment because so much is up in the air.
Stability is what we rely on to make decisions, both on the local level and on the state level. And when we have mixed signals, which we've had a number of times, it makes it hard for us to create some stability. What I can say is, like, despite that, we're working hard to create some, right? Like, we are
Yeah.
controlling what we can control to make sure that the locals have what they need in order to be able to do the work that we depend on them on. And so we share that frustration. And even within that frustration, we're finding the ways that we need to react to it to ensure that we're doing the best possible for Virginians.
So talk about that a little bit. What are the hallmarks of a strong state local partnership in the area of health and human resources? What would you like to see happen? What should people be expecting of your office, and what should they be contributing to that partnership as well?
Yeah, look, I've been I prioritize in my travels, making sure that I am going to the local social services, that I'm going to a CSB, that I'm going to whatever place allows me to see exactly what is happening in localities. We're also meeting with the leadership of these localities to get their perspective and hear it directly from them. You should expect that to continue happening. You should expect that openness to continue. And what we are going to be asking from localities is be open with us, give us that candor, give us that honesty, and at the same time come to us with that we need to solve this together. That is the expectation. So yes, the openness, but also that shared responsibility addressing those concerns that may be raised during those conversations.
I'm going to come back and ask you. My final question is going to be more about that partnership, but I'm going to go right to a question that's here. Secretary Figueroa, building on James's question, we are seeing people with significant disabilities not only having their needs met through the DOJ settlement, but instead are having authorized Medicaid waiver caregiver hours slashed, services denied, and authorizations greatly delayed. There's a concern this is part of a trend emerging nationally to balance Medicaid budgets post OBBBA on the backs of people with severe disabilities. What are your plans for ensuring this extremely vulnerable population is protected and has a place to ask for help when needed?
Yeah, we look our goal is to not see that happen in Virginia. Um, and so it is working with us, and it is us working with our Department of Behavioral Health and also our Medicaid office to track down situations in which that is actually the case, and be able to address it appropriately. What is missing from that question that you asked, Matt, is cases tend to be very unique. And so being able to give you a broad statement and it's like, this is what we're going to do moving forward is hard because every case deserves a review and every case deserves its own individual attention.
It's a hard job you've got, isn't it?
I said yes to it, man. I said yes to it.
So let's shift. Let's talk about not policy, but let's talk about leadership itself. Your career has moved across nearly every level and dimension of public service. You've worked in the U.S. Senate, helping shape federal legislation, including bipartisan healthcare policy. You worked in the U.S. Department of Health and Human Service, helping implement national priorities and partnerships with state and local governments. You've served in the Virginia state government before, helping, as we talked about, oversee Medicaid expansion and behavioral health initiatives under Governor Northam. And now you're leading health and human resources for the Commonwealth in this moment when local, state, federal systems, they're all deeply connected and under real strain at the same time. You, better than anyone, has seen firsthand how difficult it can be to move large systems while people's real lives are being affected in real time. Can I ask you to reflect on, what are the principles that guide your leadership when you wake up in the morning and you think, whatever is coming at me, I know that I have to be grounded in this. What are you thinking about?
Getting the small things right. I think a lot about families that are relying on us to be able to get the small things right. And when I think about those families, I can't help but to reflect on my own. My mom was, I'm an immigrant. I immigrated from Honduras when I was 4 years old. My mom was a school teacher in Honduras, but when she came to the States, she was a home health aide. And she worked those 12-hour shifts. And even despite those 12-hour shifts, it wasn't enough. And so it was Medicaid that allowed us to see a physician. It was housing vouchers that allowed us to keep a roof over our heads. And it was SNAP that allowed her to put food on the table in a consistent way. And so I think about those families, right? So I describe all these challenges that we're going through in this moment, and it's protecting that mother or that family's ability to have that necessary stability for her children, or even if they have children, for them to be able to have the opportunity in this dream that I get to live. And so that is my motivation. In terms of principle, it is getting the things right, communicating, and then making sure that there's follow through. But I always bring it back to getting the small things right.
I would love to ask you an even more personal question about that. I mean, the the feeling of emotion that's tied to this is significant. Are, are there opportunities when you're serving as the secretary, when you're part of the entire administration, where you actually like get to feel like personally gratified, like we actually made the change, we actually got the thing advanced or done in a way that you just know that real people are benefiting as a result of that?
Yeah, I've had some. Um, I think right now, again, if I'm telling you that my biggest priority is the implementation of OBBA or HR1 or the Big Beautiful Bill, whatever you may call it, um, I think there are two different times there are two different scenarios in public life. I think there's one where you are able to make a significant impact because you did something big in one direction, which is Medicaid expansion. We got more than 500,000 Virginians healthcare, and that was during a time that we didn't know that a pandemic was coming. That's one opportunity. There's another part where you're trying to prevent bad things from happening. And so there's opportunities where you're pushing the boulder up, and then other times where you're trying to prevent the boulder from falling too far back.
Yeah.
And so right now we're in a situation where we're trying to prevent that boulder from going too far back. And there are going to be opportunities where we are going to push it up, but this is the thing that is in front of us that is most immediate and most impactful. And so I find gratification in ensuring that our systems on the back end are not going to create the friction points that creates a situation where someone loses coverage. And I will also be trying to make progress to get more people coverage. But at the moment, it's preventing folks from losing more or from things becoming more unaffordable. While I'll still work on affordability as the governor has mandated it.
Thank you for letting me probe a little bit deeper on that. Let me remind everyone we've only got about 6 or 7 minutes left. If you've got any questions you want to put into the Q&A, I still have a couple of opportunities to ask them for you. Um, Mr. Secretary, one of the observations that came up frequently in our focus groups was that while the audience for this particular webinar are local leaders in Northern Virginia, we're part of a greater Commonwealth, and and we need to be good neighbors. Northern Virginia is a tremendous economic engine for the state, but we are not dismissive of or avoiding recognizing the totality of everything. I wonder if you have any insights of things that you wish that local leaders in Northern Virginia would keep in mind as we think about statewide implications of the policies we do, and conversely, things that you hope that people statewide will think about when we think about the impact of policies in Northern Virginia.
I just came back from Southwest Virginia with the governor, and I was raised in the Bronx. And I think one of the things that is good for Virginians to remember, and I think you alluded to that in your question, Matt, is that we are a big Commonwealth, very diverse. And so when we were leaving central Richmond, you see some population density. We would have seen more had we been leaving from Dulles or from Reagan. But when you land in Wise County, there's not that same population density when you're flying over it. And it speaks to how diverse we are. And that a policy that Northern Virginia may be pushing for because it does X, Y, and Z in Northern Virginia will touch Southwest Virginia very differently. We'll touch Tidewater, we'll touch Shenandoah, and every area between very differently. And so when you think about being a good neighbor, it is, yes, having your own interests, but also acknowledging that your interests will have an impact in the interest of someone else. And how do we craft policy in that environment? I also think it's important for us to see each other. And I think is part of my first response is seeing each other. I think there's a lot of caricature that happens on both directions, and making sure that we are seeing. I know there's a big travel distance, but seeing each other in a way with curiosity as opposed to preconceived notions of who we are. And I think, again, that creates a better situation where we are able to have better policy that helps the Commonwealth thrive as opposed to one region over another.
Again, not trying to put words in your mouth, but if I was summarizing what you just said, what I think I heard was see each other, but avoid being grounded exclusively in self-interest.
Yeah, we do better when we look at the world from each other's vantage point from time to time.
That kind of goes to one other point that came up frequently in the focus groups, a theme about trust. Trust in institutions, trust in information, trust in that the systems will function when people need them. And frankly, there are a lot of local leaders who worry that when systems become difficult to navigate or inconsistent to access, that people lose faith in the programs themselves, but more importantly, in the government itself. How do you think about the relationship between effective services and public trust?
It is essential. I agree with you. Um, if I go back to the example that I gave earlier, my mom, when she was in the Medicaid office trying to get determined if she qualified, the wait times, and just seeing her growing more frustrated. And I'm asking myself as a 5-year-old, why is she getting frustrated? In hindsight, she was a wage worker. So the time that she was spending waiting means time that she had to figure out how to make up that wage for that month, and the strain that was going to cause in her own life. And so I focused a lot on, hey, are we determining these individuals in a way that, I guess, ensures program integrity, but in a way that also ensures that they have dignity, is a question I always ask. I think the reason why I mentioned to you earlier, getting the small things right, is because when you get the small things right, that creates the confidence for you to be able to then tackle the big things. And so that is something that I consistently talk to my agencies about, because everybody, right, wants to do the big things. You don't have to go fishing for whales all the time. Do the small things right, and that will build upon itself.
We have just about 2 minutes left, and I have one last question for you, which is in this moment when there is still so much uncertainty, when the budget is still not decided, when there's, a lot of confusion about what's going to be happening, whether it's turbulence or whether it's the new normal, what would be most helpful for you to hear from local leaders in Northern Virginia right now?
How can we tackle these things together? I think you heard in the last hour that we've been engaging, Matt, is the challenges that I see. I see HR1 being a challenge that we have to deal with, both from the Medicaid end and the SNAP end. How do we ensure that people keep their coverage, and also how do we make sure that food insecurity doesn't increase? Those are things that we could work on together. Behavioral health is another state and local partnership. Where are they seeing the gaps as to what we need to do? We have resources, but there are also local resources we can take advantage. We can leverage. Where we create alignment between those two things. Those are the areas, right? So I think there are a number of different areas where, yes, there's a lot of turbulence. Yes, there's a lot of instability. But how can we use this opportunity to make sure that we are aligned to create a stable ground for people to walk on?
I'm going to ask this again real quick. So, what would you like to hear from leaders in Northern Virginia that would actually be helpful for you in this moment?
How do we make sure that people keep coverage? So how are we communicating with people to ensure that they know what is coming? On SNAP, how do we make sure that people know that they qualify for these new requirements, and how do we make sure that they're ensuring that they keep that food assistance program?
Okay. Secretary Marvin Figueroa, on behalf of RELI, Regional Elected Leaders Initiative at the Schar School of Policy and Government at George Mason University, thank you. Thanks for
Of
taking
course,
the
of course.
time to speak with us. Thanks for your leadership on these issues. We very much appreciate the conversation. It's great that you could join us. I also want to thank RELI for bringing local leaders together and helping surface the perspectives that shaped this community. I'm sorry, that shaped this discussion. And to everyone who joined us, thank you. Many of you we know are navigating these same challenges in your own communities, and your engagement here is a part of what makes conversations like this meaningful. RELI Spring Webinar Series continues next on June 12th with Secretary of Natural and Historic Resources David Bulova. We hope you'll join us. I'm Matt Lehrman of Social Prosperity Partners. Thanks everyone for being with us. We look forward to continuing the conversation. And again, Mr. Secretary, thank you again so much for joining us.
Thank you.
Thank you very much.